and non-communicable disease. Now, when you take all the non-communicable diseases into consideration, the total number of deaths, the NCD accounting for total number of deaths is 53% of deaths. More than 50% communicable diseases, and most of the non-communicable diseases are lifestyle diseases. Lifestyle diseases, right? Now, out of this, 17.7% of this 53%, that means total 24% of deaths are due to cardiovascular diseases. That means your circulatory system is causing almost 24% of diseases of NCD, amounting to 53% of total deaths across the globe. Now, maybe when you are looking at the percentages, it looks very small. Convert it into the number of people dying. About 24% of deaths across the globe are because of cardiovascular diseases, because the heart and the are not functioning properly. Now let us come to India. In India, it accounts for 1/5 of these deaths. This 24%, 1/5 of these deaths of 24% happen in India. Now that is a huge number of patients when you convert it into numbers. CVD, and that is also not all that matter of this point which says that cardiovascular diseases strike India a decade earlier than the Western population. If the Western people are prone to cardiovascular diseases at the age of 50, in India, at the age of 40, people are more prone to cardiovascular diseases. That means cardiovascular diseases strike us 10 years earlier in age than what it does in other countries. Imagine, India is supposed to be having a huge population of middle-aged people. And this is the most productive age in your life where you will be contributing to the economic growth of the country. And this part, this cardiovascular. So, more striking than that is world's global burden of the disease due to CVD or cardiovascular disease is 235 per 1 lakh, whereas for India it is 272 per 1 lakh. We are not achieving anything by ranking up in these matters. But because of the change in lifestyle, because of the increase in stress levels, this is what has been happening to Indian population. To sum up this part of the slide, I would say that cardiovascular diseases are hitting the most productive population and lives of the people who are in their prime age. Next slide. Now, there are more facts which are more distinct. The number of deaths because of the disease and its fast pace of progression is much more among the Indian population than the Western population. Does that ring an alarm for us that we should plunge into the field and do something? Why is it that we need to plunge into the field? I'll come to it a little later. CVD deaths, and if you compare the statistics, is very glaring. You can see the disease progression and the damage caused by the disease very glaringly. It stares at us. You see that CVD deaths in 1990 was 15.2%, and in 2016, 28.1%, and the DALI in 1990 was 6.9%, and it increased to 14.1% in 2016. We write our answers, when we write our reports, we use these statistics. These are not meant only for academic use, but these statistics are meant for introspection, for, the cognitive stirring, and for the people to set into action in order to arrest this. If at all the projection is that by 2035, 50% of Indians, every second person in India is going to have cardiovascular disease. I mean, we are talking so much about nationalism. We are talking so much about, patriotism. Our patriotism should prompt us and push us towards thinking that I am not going to allow this to happen to my fellow Indians. And if at all by 2035, this is the projection. As a scientist, as a medical scientist, as a social scientist, as a behavioral scientist, what is it that I can do in order to take the challenge and see to it that these projections are arrested? That should be the spirit that we need to have. Then again, you see that between 1990 and 2013, there was an increase of 138% in deaths due to hypertension diseases. Hypertension is nothing but high blood pressure. If I take a survey of the university employees today, I'm sure more than 50% of the employees would confess and tell me that they are taking medication for high blood pressure, right? So it has become so common that we accept it as if we are having just a running nose or a fever or a cough. But it is not as simple as that. So liability for, this is another thing. We are so complacent about the disease because the disease has become so common. Earlier days, somebody has a heart problem, cardiac problem, very, very concerned. But now, he has a cardiac problem. After 40, as if the way you are getting a specs for your reading glasses, similarly you are getting cardiac diseases also. So the cardiac problem has become as common as wearing a specs. Then this is the most important aspect for the students of psychology to know. So they are not on prescribed diet, prescribed medication. So this is the most important thing to make us think about behavioral cardiology. Next slide, please. Yeah. So, what are the risk factors for coronary heart disease or cardiovascular diseases? Diabetes, hypertension, obesity, and low HDL and high LDL. It is called dyslipidemia. So the first four conditions will have to be taken care of. The progressive increase in the incidence of cardiovascular diseases among the people of India. And what are these four factors? If you look at these four factors, these four factors are very closely connected with the psychological state of the human being. That means the inappropriate diet is something which is within the control of the human being. Similarly, sedentary lifestyle, the behavior of the individual will have to change. Smoking, it's a health risk behavior, and high stress levels. These are the things prevention, so that all these four factors out of the 9 factors can be handled by health psychology. Nearly 50% of the risk factors for cardiac condition, then management is nothing here, and this behavior needs to be triggered by appropriate motivation, and this motivation will be generated only when there is appropriate. Those of you who are studying the the importance of triggering the right emotion, motivation or emotion must have a cognitive base. That means there should be appropriate knowledge about the disease, the causes of the disease, symptoms of the disease, how to handle the disease. Unless there is an appropriate knowledge, the fear won't be generated. Unless there is fear, the person will not be motivated. Unless there is motivation, there won't be any choice for hypertension. Why it is caused? Why should there be a low salt and low fat diet? Why should there be exercise? What does this exercise do to your physiology and all? No doctor explains this to you, the questions. So we conducted a study on the quality of communication between. I'm hurrying up a little fast. You have any questions, you will ask later, because I'm cautioned that there will be a power off at 12:30. Had each group. One group had one doctor and 10 patients. took 30 doctors and 300 patients.